The birth of a baby is often celebrated with congratulations, presents that can fill a room, and pictures to remember every second of the day. But what happens when your post-baby body makes you feel like a monster? Or what if you don't even want to get out of bed? Not even to feed your baby? What are the baby blues? Commonly called the baby blues. The postpartum baby blues is a temporary mild form of depression. Typically, the baby blues start a few days after delivery and go away on their own within a few weeks. If your symptoms don't go away after a few weeks, or they get worse, you may have postpartum depression. Some signs and symptoms of the baby blues include crying for no reason, sadness, and anxiety. Postpartum depression. Postpartum depression is more serious than the baby blues. The symptoms are more persistent than those of the baby blues, and they interfere with your ability to function. Because of the severity of symptoms, postpartum depression often requires professional treatment. It's important to understand that postpartum depression doesn't happen because of something you did or did not do. And having postpartum depression does not mean a mother does not love their baby. It is a mental health condition. These factors may trigger postpartum depression. Having a newborn in the NICU. Not having adequate help for your newborn, which can create additional anxiety or stress for you as a new mom. Hormonal fluctuations. A mental health diagnosis prior to being pregnant. Being sleep deprived. The stress of returning to work not long after your baby arrives. As a result, having a short bonding experience with your baby. Postpartum depression affects every woman differently. A woman experiencing postpartum depression may have emotional, mental, physical or behavioral symptoms. A few emotional symptoms can include anxiety and fear, getting easily frustrated, excessive and uncontrollable crying, having extreme mood swings, feelings of anger, rage, numbness, emptiness, guilt and/or shame, irritability and restlessness, persistent feelings of sadness and hopelessness. A few mental health symptoms can include difficulty making decisions, doubts about being able to care for the baby, feelings of failure or inadequacy, unable to concentrate, thinks things are too overwhelming to handle, trouble remembering details. Physical symptoms can include changes in appetite, eating too much or too little, fatigue and loss of energy, headaches, muscle aches and pains, stomach pains, trouble sleeping or sleeping too much. Patterns of behavioral changes can include some of the following: acting distant with your partner, afraid of being alone with the baby, angry behavior toward others, fearful of harming the baby to the point you are withholding care, unable to bond with the new baby, unable to enjoy time with friends and family, withdraws from friends and social activities. So what should you do about postpartum depression? The good news is postpartum depression is treatable. If you experience any of these signs, symptoms, thoughts or feelings, call your OB/GYN doctor or primary care provider. If you have thoughts or feelings of wanting to hurt yourself, your baby or others, tell someone, and go to the nearest emergency room immediately. If you think a loved one may be experiencing postpartum depression, the best thing you can do is listen, provide support and help in any way you can. Offer to watch the baby while the mom rests, meets up with friends or just has some time alone. Go grocery shopping for the family, or prepare a meal. Encourage her to talk with her doctors, and go to the appointment with her. Don't forget moms, you may not be experiencing all of these symptoms, or even most of them. Postpartum depression is not a one-size-fits-all illness. Also don't forget that your partner may be experiencing some of the same feelings that you may be feeling. Did you know, dads can experience postpartum depression also? As with women, men can experience depression at any time, even before their baby is born. During their postpartum visit, most new moms are checked for depression and anxiety symptoms. But there is no such checkup for men. It's important that if a man starts feeling depressed, they should seek professional treatment. Couples therapy, especially if both parents are depressed and/or the relationship is suffering, is a great option. You may need medication that works on the mind, behavior, or mood. Complementary or alternative therapies, such as exercise, massage, or acupuncture are also great options. A lot of the time, you may be experiencing several of the symptoms and you may not have postpartum depression. It may be the feeling of being a new mom. That's why it's very important you talk to your doctor and find out the best care plan for you and/or your partner. Be sure to take care of yourself, and enjoy your new baby as much as possible. Tell us how you're handling your symptoms of postpartum depression in the comments section below. And thanks for watching Tiny Tribe Parents. If you enjoyed this video, please click the like button, comment and subscribe to our channel for more incredible content that is on the way.